Welcome back. South Africa has recorded 1,897 new COVID-19 cases and a further 48 deaths in the last 24 hours, bringing the number of infections to 712,412 coronavirus cases since the start of the pandemic. What has created concern, though, is the recording of 4,000 new COVID-19 cases in 2 days. Medical experts and government officials have raised concerns about the possibility of a second wave of coronavirus cases in South Africa if we don't take care. To speak more on this is Professor Glenday Gray. She is president of the South African Medical Research Council. A very good evening to Professor Gray, and thank you so much for speaking to us. I want to just look at these latest figures. I've mentioned the figures and what the resurgence has been like over the past 24 hours and 48 hours. But what should we read into this data? Is it a resurgence leading to a second wave?
So a very important thing to note is that we never ever were able to eradicate or eliminate COVID-19 from our country in the last couple of months. And although we tried to slow down transmission, elimination was never ever part of the plan, because one can't do that without a full-scale testing and tracing capacity. So what we do expect as we ease down the lockdown is we do expect transmission to continue. And what's important at this stage is the slowing down of the transmission is all in our control. So as citizens in this country, we have to wear masks, we have to physically distance, and we have to make sure that we wash our hands and avoid congestion. And so we can slow down the transmission and we can manage the epidemic if we continue to implement what we call non-pharmaceutical interventions.
And I want to reflect back at the start of the pandemic. We were seeing a similar sort of trend, isn't it? But there was an increased...
Yes,
Go ahead.
Sorry. So we saw in the beginning of the epidemic, we were trying to prevent community transmission. And so the country went into lockdown to try and prevent that. And so while we were in lockdown, community transmission continued. And although we were able to slow down the transmission and we were able to flatten the curve, we were never able to eliminate COVID-19 from our country. And so because COVID-19 is still circulating in our country, we will get transmission. And the only way we can control transmission in our country is to use the tools that we have, which are the non-pharmaceutical interventions, and wait for the vaccine. Obviously, the more people who get infected in the country, there is some kind of immunity that may help protect the population. But the most important thing for us at this stage is to make sure we slow it down by implementing what we know works, and that is keeping away from people, wearing masks, washing hands, and making sure we're not in congested areas and making sure there's ventilation. So the tools are in our hands. They're not a vaccine and they're not treatment, but the tools are very powerful if we use them properly. It's like using condoms during HIV, and we knew that a condom could protect against HIV. And in the same way, masks can prevent us who have the virus from spreading it, because the mask will protect the people in front of us. And people who have it, if we are wearing masks and we're keeping our distance, we will get exposed much less to the virus.
Professor Gray, let's move away from that and now focus on the data, because we've seen a general reduction, a significant, in fact, reduction of incident risks in the provinces, but we have seen an increase of about 102 in the daily deaths, even though recoveries have climbed. I want to look at the modelling. As I mentioned, we're seeing a similar trend, but there was a burden on the healthcare system in the beginning. It's different now, but what does the current figures tell us? People are not adhering to these health protocols that you're talking about. We're seeing an increase. People are panicking, saying that we are already in a second wave. I just want us to look at the data and read it. How do we decipher it?
So we do expect a resurgence, or what we call a second wave. And the second wave, the velocity and the magnitude of the second wave depends on the citizens of the country. And so when you're not able to eliminate SARS-CoV-2 from your community, it'll continue to circulate. And I think that's what we're seeing at this moment in time, what we're seeing in South Africa and what we're seeing abroad. And what we saw abroad was that there was COVID-19 fatigue. And so people started to mix. They never wore their masks in public, and so they spread. And we saw some of these outbreak phenomenon in certain places in South Africa, in clubs and in other areas. And so our job is to prevent super spreading events and to make sure that we protect people by complying to the interventions that we know work. I know it sounds like I'm harping on one thing, but there's only one thing that can help us in South Africa at this moment in time, and that's the fastidious implementation of these rudimentary tools that we do know work.
And some of the super spreader events that we've seen have been attributed to complacency, according to an HSRC study. And I'm also quite intrigued by you saying that a resurgence is a second wave. The health minister was saying, yes, we're seeing a resurgence, but we're not quite at a second wave. Why does there seem to be a different application of the term between the two of you?
Well, we like to, whether you use the word resurgence or you use the word, people use the word resurgence and second wave interchangeably. And obviously when we see a resurgence, it means that the magnitude of the epidemic is going up and that there are more people that are getting infected. And I guess the second wave would be looking to see when there is a peak. So whether you use the word resurgence or second wave, it's an interchangeable term. And we like to use the word resurgence because we were never able to eliminate SARS-CoV-2 from South Africa. Okay. It's virtually impossible to eliminate. So if you still have circulating virus, you're going to get transmission. And if the transmission gains velocity, you will start to get resurgence, which means returning back to more cases. And so instead of having a low limit, a low grumbling level of virus transmission, we're starting to see what I call a resurgence of the epidemic, which means that we have got fatigue. It means that people are not paying attention to preventing transmission and not protecting themselves.
Do you predict an exponential rise? And I'm asking this because last week at this time, I was speaking to a researcher at the CSIR. Then the cases were at over 1,900 in the last 24 hours. As we speak now, as I mentioned, over the past 48 hours, there was an increase of 4,000. So are we going to continue seeing an exponential rise if people don't do what you're saying? We've got to go back to adhering to those safety protocols.
The prediction and the power of this resurgence is in our own hands as the citizens of this country. And so if we take care, if we try and protect ourselves and protect our fellow citizens, we can control the resurgence and we can control the second wave. And so it's all in our hands. And so I'm not, it's hard for me to predict what's going to happen, but what I am trying to implore is that South Africans take this epidemic seriously. Every death that happens due to COVID-19 is tragic, and every transmission and every hospital admission is tragic. And we know what we have to do. And even though it may seem hard and difficult at times, we still have to make sure that we put on our masks and we do what we have to do as citizens of South Africa. And so our job is to protect people and to protect the elderly and the vulnerable. And all of us can do it. I can do it and you can do it.
We appreciate your counsel. Thank you very much for speaking to us, Professor Glenday Gray. She is the president of the South African Medical Research Council. Now, coming up at 7 p.m., 1900 hours, we'll be having